Let's talk about the movements of mastication. Let's talk about mastication. The movements of GIT we are going to talk in this particular audio session. Mastication or chewing is the first mechanical process in gastrointestinal. Okay, let's talk about the mastication. Mastication or chewing is the first mechanical process in gastrointestinal tract by which food substances are torn or cut into small particles and crushed or grouped into soft bolus. So mastication or chewing is the first mechanical process of gastrointestinal tract by which food substances are torn or cut into small particles and crushed or ground into soft bolus. Significance of mastication: breakdown of foodstuffs into smaller particles, mixing of saliva with food substances thoroughly, lubrication and moistening of dry food by saliva so that the bolus can be easily swallowed, appreciation of taste of the food. Significance of mastication: breakdown of foodstuffs into smaller particles, mixing of saliva with food substances thoroughly, lubrication and moistening of dry food by saliva so that the bolus can easily swallowed, appreciation of taste of food. That's very important for us, appreciation of taste of food. So mastication or chewing is the first mechanical process in GIT by which food substances are torn or cut into small particles and crushed or ground into a soft bolus. So small particles and bolus formation. So if the food is dry, we can lubricate and moisten it so that it can be easily swallowed, and appreciation of taste, mixing of saliva with the food substance thoroughly, and breakdown of foodstuffs into smaller particles. Muscles and movements of mastication. Talking about muscles and movements of mastication. So muscles of mastication: masseter muscle, temporal muscle, pterygoid muscle, and buccinator muscle. So these are the four muscles: masseter, temporal, pterygoid, and buccinator. Movements of mastication: opening and closure of mouth. Opening and closure of mouth, rotational movements of jaw, protraction and retraction of jaw. आप कैसे अभी आया? अच्छा हाँ अच्छा हाँ
जीके पाल यूज़ करा था ना?
हाँ जीके पाल भी एक बार चेक करेंगे शैम्पू में कैसा है वो।
मेरी दीदी बोले थे कि लास्ट मोमेंट में बुक्स चेंज नहीं करना, बल्कि लाइक जस्ट एन एडवाइस, क्योंकि नहीं तो फिर मुश्किल होती है, क्योंकि आप जो बुक से पहले से पढ़ के दैट वुड बी इजी फॉर यू टू रिमेंबर, क्योंकि आपको ऐसा याद रहता है कि अरे हाँ मैं ये पढ़ी।
हाँ ये जगह से मैं चैप्टर नहीं पढ़ी जीके पाल में, तो इसमें पढ़ी।
ठीक है
आपका हो रहा है पढ़ना? So movements of mastication: opening and closure of mouth, rotational movements of jaw, protraction and retraction of jaw. Protraction, retraction, rotational movements of jaw, opening and closure of mouth. Now, most important, control of mastication. Action of mastication is mostly a reflex process. It is carried out voluntarily also. The center for mastication is situated in medulla and cerebral cortex. Muscles of mastication are supplied by mandibular division of fifth cranial nerve, trigeminal nerve. Trigeminal nerve. Control of mastication. Action of mastication is mostly a reflex process. It is carried out voluntarily also. The center for mastication is situated in medulla and cerebral cortex. Muscles of mastication are supplied by mandibular division of fifth cranial or trigeminal nerve. Fifth cranial or trigeminal nerve. Because the muscles of mastication are supplied by the mandibular division of trigeminal nerve. Fifth cranial nerve का mandibular division. The center for mastication is situated in medulla and cerebral cortex. Medulla oblongata and cerebral cortex में muscles of mastication रहता. Muscles of mastication का center कहाँ पे है? Medulla and cerebral cortex. Now talking about deglutition. So there's question called stages of deglutition. So let's discuss about it. It's a very vast topic. Deglutition definition: swallowing or deglutition is the process by which the masticated food moves from mouth into the stomach via pharynx and esophagus. Swallowing or deglutition is the process by which masticated food moves from mouth into stomach via pharynx and esophagus. Mouth to stomach, by which the masticated food moves from mouth to stomach via pharynx and esophagus. This is the deglutition. So it has to go from mouth, pharynx, esophagus, and then the stomach. What are the stages of deglutition? Deglutition occurs in 3 stages: oral stage, pharyngeal stage, esophageal stage. Oral stage of food moves from mouth to pharynx. In oral stage, food moves from mouth to pharynx. In oral stage, food moves from mouth to pharynx. In oral stage, food moves from mouth to pharynx. Pharyngeal state, food moves from pharynx to esophagus. Esophageal state, food moves from esophagus to stomach. So deglutition means you are swallowing the food from the mouth to the stomach. This is the process by which the masticated food moves from the mouth to the stomach. In that, mouth to pharynx, pharynx to esophagus, esophagus to stomach. So oral stage, from mouth to pharynx, pharyngeal stage, pharynx to esophagus, esophageal stage, esophagus to stomach. Let's talk about first stage, oral stage or first stage. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. So in oral stage or first stage, oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. So oral stage of deglutition is a voluntary stage. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Sequence of events during oral stage. Bolus is placed over posterior dorsal surface of the tongue. It is called the preparatory position. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. So oral stage of deglutition is a voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. So sequence of events during oral stage. Bolus is placed over posterior dorsal surface of the tongue. It is called the preparatory position. Anterior part of tongue is retracted and depressed. Posterior part of tongue is elevated and retracted against the hard palate. This pushes the bolus backward into the pharynx. Forceful contraction of tongue against the palate produces a positive pressure in the posterior part of the oral cavity. This also pushes the food into pharynx. So here, sequence of events during oral stage. So bolus is placed over posterior dorsal surface of the tongue. So bolus is placed over posterior dorsal surface of tongue. It is called the preparatory position. Anterior part of tongue is retracted and depressed. So bolus is placed over posterior dorsal surface of the tongue. It is called the preparatory position. Anterior part of the tongue is retracted and depressed. Posterior part of the tongue is elevated and retracted against the hard palate. Full contraction of tongue against the palate position. Anterior part of the tongue is depressed and retracted, and this also pushes the food into pharynx. So oral stage or first stage is the voluntary stage. In this stage, the bolus from mouth passes into pharynx by means of series of actions. Sequence of events: retracted and depressed. Posterior part of it produces a positive pressure in the posterior part of the oral cavity. This also pushes the food into pharyngeal stage or second stage. Pharyngeal stage is an involuntary stage. But pharyngeal stage, the second stage, is an involuntary stage. In this stage, bolus is In this stage, in the pharyngeal stage, it is an involuntary stage. In this stage, bolus is pushed from pharynx into the esophagus. Bolus is pushed from pharynx into the esophagus. Pharyngeal stage is an involuntary stage. In this stage, bolus is pushed from pharynx into esophagus. Pharyngeal stage is an involuntary stage. In this stage, bolus is pushed from pharynx into the esophagus. Pharynx is a common passage for food and air. Pharynx is a common passage for food and air. Pharynx is a common passage for food and air. Pharynx is a common passage for food and air. Pharynx is a common passage for food and air. Pharynx is a common passage for food and air. So it divides into larynx and esophagus. Larynx lies anteriorly and continues as respiratory passage. Larynx lies anteriorly and it continues as respiratory passage. Esophagus lies behind the larynx and continues as GI tract. Since pharynx communicates with mouth, nose, larynx and esophagus during this stage of deglutition, bolus from the pharynx can enter into 4 paths back into the mouth. Pharynx is a आना नहीं हो रहा था इतनी दूर से.
पढ़ाई तो हुई ना?
नहीं
इसलिए अच्छा करे आ गए. अब देखो अब तक जितना भी हुआ चलता थोड़ा बहुत करो सही भी. अल्लाह मुश्किल देखो थोड़े दिन कर लो आगे. कि कब तक जाते फिर? जल्दी आओ. आप लेट आए ना आज?
हाँ 12:30 को पहुँची. मैं वहाँ से 11 को निकली एंड यहाँ पे 12:30 को पहुँची.
हाँ वो होता. छोड़ो मेरा भी फिर दूरी से मेरे को भी 1 घंटा लगता. तो कोई ना इंशाल्लाह आप रोज़ आओ. फिर अच्छी पढ़ाई हो जाती. एक माहौल रहता. मूड नहीं भी रहा तो हो जाती मालूम. घर में नींद आती. कुछ तो भी होता ही होता. इंशाल्लाह खैर होगा. डरो मत. तो लेकिन यहाँ से सब अच्छा हो जाता. 1 महीना है ना सॉलिड क्वेश्चन पेपर कुछ करें ना आप खाली.
हाँ लेकिन जो चैप्टर्स बिल्कुल भी नहीं पढ़े सो है वो
अभी के लिए वो ख़त्म करना चाह रहे हैं ना. तो पूरा चैप्टर तो नहीं पढ़ रहे ना. खाली क्वेश्चन ही करो इंपॉर्टेंट वाले. जो बहुत इंपॉर्टेंट है वही करो अभी के लिए. तो जल्दी फिनिश करो और क्वेश्चन पेपर सॉल्व करना शुरू कर देना. 15 दिन पहले तो एटलीस्ट 15-20 दिन पहले.
उतने ही दिन बचे
वो है 1 वीक में ये जो भी न्यू चीज़ें हैं वो ख़त्म करो. और उसके बाद से बाकी का पूरा टाइम क्वेश्चन पेपर सॉल्व करो. एक एक क्वेश्चन पढ़ो, पढ़ते जाओ. रिवाइज करते जाओ. आंसर नहीं समझ में आ रहा क्वेश्चन पे उसमें देखते जाओ. समझे? टेक्स्ट बुक में एक ही तो टेक्स्ट बुक रहती है. एक सब्जेक्ट का देखते जाओ. वैसा आप कंप्लीट करते जाओ. उसके 2 बार रिविजन होना वाले क्वेश्चन पेपर के लास्ट यानी उसके 2 बार. एंड फिर टाइम मिला तो इंस्टेंट्स के भी करो. पूरे सीनियर्स बोले सही थे मेरे को ट्रस्टेड वाले. तो मैं तो वही करने वाली. 7 डेज में मैं जितना भी हुआ ऐसा रिविजन ऊपर से इंपॉर्टेंट क्वेश्चन देख लेने वाली. फिर क्वेश्चन पेपर स्टार्ट करना वाली.
फिर क्वेश्चन पेपर का रिवीजन कैसा?
फिर से करना सॉल्व क्वेश्चन पेपर. सेम क्वेश्चंस को 3 बार करना. तो आपको लिखना है
फिर से पढ़ना.
हाँ
यू मीन पढ़ना प्रिपेयर करना.
हाँ बार 3 रिविजन तो मिनिमम कंपल्सरी महनाजमान भी बोलते हैं. समझे? एग्ज़ाम से पहले. तो अभी अपन करना ट्राई करना.
सेंट्रल लाइब्रेरी में बैठ सकते हैं.
मैं पूछी लेकिन नहीं देते. मतलब 3 बजे के बाद अलाउ है.
अच्छा. Okay, so we are talking about pharyngeal stage or second stage. In pharyngeal stage is an involuntary stage, and in this stage bolus is pushed from pharynx into esophagus. Pharynx is a common passage for food and air. It divides into larynx and esophagus. Larynx lies anteriorly and continues as respiratory passage. Pharynx is a common passage for food and air. It divides into larynx and esophagus. Larynx lies anteriorly and continues as respiratory passage. Esophagus lies behind the larynx and continues as GI tract. Since pharynx communicates with the mouth, nose, larynx and esophagus during this stage of deglutition, bolus from pharynx can enter into 4 paths. It can enter into nose, it can enter into larynx, it can enter esophagus in this stage of deglutition. Can enter into these 4 paths. So it can go back into the mouth, it can go upward into the nasopharynx, it can forward into the larynx, and can downward into the esophagus. So 4 paths: back into the mouth, upward into the nasopharynx, forward into the larynx, downward into the esophagus. So, however, due to various coordinated movements, bolus is made to enter only the esophagus. Entrance of bolus through other parts is prevented. Back into mouth. Return of bolus back into mouth is prevented by position of tongue against the soft palate. Back into mouth. Return of bolus back into mouth is prevented by position of tongue against the soft palate. Against the soft palate, roof of mouth, and high intraoral pressure developed by movements of tongue. How high intraoral pressure is developed? Posterior part of tongue is elevated and retracted against the hard palate. This pushes the bolus back into the pharynx. Forceful contraction of tongue against the palate produces a positive pressure in the posterior part of oral cavity. So it prevents back into the mouth. Return of bolus back into mouth is prevented by position of tongue against the soft palate, roof of the mouth, and high intraoral pressure developed by movement of tongue. So return of bolus back into mouth is prevented by position of tongue against the soft palate, roof of the mouth, and high intraoral pressure developed by movement of tongue. Upward into nasopharynx. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. So movement of bolus into nasopharynx from pharynx. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Upward into nasopharynx. Back into mouth. Return of bolus back into mouth is prevented by position of tongue against the soft palate, roof of mouth, and high intraoral pressure developed by movement of tongue. Pressure and the position of tongue. This prevents a backflow of food into the mouth. Upward into nasopharynx. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Movement of bolus into nasopharynx. Bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. So extension of uvula. Soft palate is the uvula. Extension of a soft palate is called uvula. So movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Soft palate along with its extension called uvula. Forward into larynx. Movement of bolus into larynx is prevented by following actions: approximation of vocal cords, forward and upward movement of larynx, backward movement of epiglottis to seal the opening of larynx. All these movements arrest respiration for a few seconds. It is called deglutition apnea. Deglutition apnea refers to temporary arrest of breathing. Deglutition apnea or swallowing apnea is arrest of breathing during pharyngeal stage of deglutition. So back into mouth. Return of bolus back into mouth is prevented by position of tongue against the soft palate. Return of bolus back into the mouth is prevented by position of tongue against the soft palate, roof of mouth, and high intraoral pressure developed by movement of tongue. Upward into nasopharynx. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Forward into larynx. Movement of bolus into larynx is prevented by following actions: approximation of vocal cords. Forward into nasopharynx. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Movement of bolus into nasopharynx from pharynx is prevented by elevation of soft palate along with its extension called uvula. Forward into larynx. Movement of bolus into larynx is prevented by following actions: approximation of vocal cords, forward and upward movement of larynx, backward movement of epiglottis to seal the opening of larynx. All these movements arrest respiration for a few seconds. It is called deglutition apnea. So there are three stages of deglutition: swallowing or deglutition. Definition: is the swallowing is the process by which the masticated food moves from mouth into the stomach via pharynx and esophagus. Stages of deglutition. Deglutition occurs in three stages: oral stage, food moves from mouth to pharynx; pharyngeal stage, and esophageal stage. So in oral stage, sequence of events we have seen about the tongue. Pharyngeal stage or second stage we have seen in that four pathways from pharynx to four paths it can go: back into mouth, upward into nasopharynx, forward into larynx. We have seen deglutition apnea. Apnea is a temporary arrest of breathing. While deglutition, the apnea is occurring during pharyngeal stage of deglutition, and it is called for deglutition apnea. Talking about choking. Choking is the inability to breathe due to obstruction or compression of respiratory passage. Okay, so choking is the inability to breathe due to obstruction or compression of respiratory passage. Sometimes during second stage of swallowing, solid food particles may enter larynx, resulting in obstruction and choking. However, it may be prevented automatically by gag reflex. Choking is the inability to breathe due to obstruction or compression of respiratory passage. Sometimes during second stage of swallowing, solid food particles may enter larynx, resulting in obstruction and choking. However, it may be prevented. Sometimes during second stage of swallowing, solid food particles may enter larynx, resulting in obstruction. So gag reflex or pharyngeal reflex is the elevation of soft palate and retching, strong involuntary effort to vomit or gagging, opening of mouth. It is initiated by touch of a wisp of cotton or any other object such as solid food particle at roof of mouth, back of tongue, uvula, tonsils, or back of throat. It occurs by mass contraction of the posterior oral and pharyngeal muscle and elevation of the soft palate. Gag reflex is an automatic normal protective reflex and it prevents choking. So gag reflex or pharyngeal reflex is the elevation of soft palate and retching. Gagging means opening of mouth or involuntary effort to vomit. Is initiated by touch of a wisp of cotton or any other object. It's a solid food particle at roof of mouth, back of tongue, uvula, tonsil, or back of throat. It occurs by mass contraction of posterior oral pharyngeal muscle and elevation of the soft palate. Okay. In choking, we have seen now entrance of bolus into esophagus. Since other three paths are closed, the bolus has to pass only through esophagus. This occurs by combined effects of various factors. Upward movement of larynx touches the opening of esophagus. Simultaneously, upper 3 to 4 centimeters of esophagus relaxes. This part of esophagus is formed by cricopharyngeal muscle. It is called upper esophageal sphincter or pharyngoesophageal sphincter. At the same time, peristaltic contractions start in the pharynx due to contraction of pharyngeal muscle. Elevation of larynx also lifts the glottis away from passage of food passage. Since other three paths are closed, the bolus has to pass only through esophagus. So this occurs by combined effect of various factors. Upward movement of larynx touches the opening of esophagus. Simultaneously, upper 3 to 4 centimeters of esophagus relaxes. This part of esophagus is formed by cricopharyngeal muscle and is called upper esophageal sphincter or pharyngoesophageal sphincter. At the same time, peristaltic contractions start in the pharynx due to contraction of pharyngeal muscles. Elevation of larynx also lifts the glottis away from food passage. All the factors mentioned above act together so that bolus moves easily into the esophagus. The whole process takes place within 1 to 2 seconds, and this process is purely involuntary. Esophageal stage or third stage is also an involuntary stage. In this stage, food from esophagus enter the stomach. Esophagus forms a passage for movement of food bolus from pharynx to stomach. Movement of esophagus are specially organized for this function, and the movements are called peristaltic waves. Peristalsis means a wave of contraction followed by a wave of relaxation of muscle fibers of GI tract, which travel in a boral direction away from mouth. By this type of movement, the contents are propelled down along the GI tract. When bolus reaches the esophagus, the peristaltic waves are initiated. Usually, two types of peristaltic contractions are produced in esophagus. Esophageal stage is also an involuntary stage. In this stage, food from esophagus enters the stomach. Esophageal stage is also an involuntary stage. In this stage, food from esophagus enter the stomach. In this stage, food from esophagus enter the stomach. In this stage, food from esophagus enter the stomach. Esophagus forms the passage for movement of bolus from pharynx to stomach. Movement of esophagus are specially organized for this function, and movements are called peristaltic waves. Peristalsis means a wave of contraction followed by a wave of relaxation of muscle fibers of GI tract, which travel in a boreal direction away from mouth. By this type of movement, the contents are propelled down along the GI tract. When bolus reaches the esophagus, the peristaltic waves are initiated. Usually, two types of peristaltic contractions are produced in esophagus. So, they are divided into primary peristaltic contractions and secondary peristaltic contractions. In primary peristaltic contraction, when bolus reaches upper part of esophagus, the peristalsis starts. This is known as primary peristalsis. After origin, the peristaltic contractions pass down through rest of the esophagus, propelling the bolus towards the stomach. Pressure developed during the primary peristaltic contraction is important to propel the bolus. Initially, the pressure becomes negative in upper part of esophagus. This is due to stretching of the closed esophagus by elevation of larynx. But immediately, the pressure becomes positive and increases up to 10 to 15 centimeters of water. Secondary peristaltic contractions. If the primary peristaltic contractions are unable to propel the bolus into stomach, secondary peristaltic contractions appear and push the bolus into stomach. Secondary peristaltic contractions are induced by distension of upper esophagus by the bolus. After origin, this contraction pass down like the primary contractions, producing a positive pressure. Role of lower esophageal sphincter. Distal 2 to 5 centimeter of esophagus forms a lower esophageal sphincter. It is constricted always. It is always constricted. When bolus enters this part of esophagus, the sphincter relaxes so that the content enter the stomach. After entry of bolus into stomach, the sphincter constricts and closes the lower end of esophagus. Relaxation and constriction of lower esophageal sphincter occurs in sequence with the arrival of peristaltic contractions of esophagus. Role of lower esophageal sphincter. Distal 2 to 5 centimeter of esophagus forms lower esophageal sphincter. Distal 2 to 5 centimeters of esophagus forms lower esophageal sphincter. It is always constricted. When bolus enters this part of esophagus, this sphincter relaxes so that the contents enter the stomach. After entry of bolus into stomach, this sphincter constricts and closes the lower end of esophagus. Relaxation and constriction of lower esophageal sphincter occurs in sequence with the arrival of peristaltic contraction of esophagus. Deglutition reflex. Though the beginning of swallowing is a voluntary act, later it becomes involuntary and is carried out by a reflex action called deglutition reflex. It occurs during pharyngeal and esophageal stages. Sequences of deglutition reflex. When bolus enters the oropharyngeal region, the receptor present in this region are stimulated. Afferent impulses from oropharyngeal receptors pass via glossopharyngeal nerve fibers to deglutition centers, which is situated at the floor of fourth ventricle medulla oblongata of brain. Impulses from deglutition center travel through glossopharyngeal and vagus nerves, parasympathetic motor fibers, and reach soft palate, pharynx and esophagus. Glossopharyngeal nerve is concerned with pharyngeal stage of swallowing. Vagus nerve is concerned with esophageal stage. Now, the reflex causes upward movement of soft palate to close nasopharynx and upward movement of larynx to close respiratory passage so that bolus enters the esophagus. Then, peristalsis occurs in esophagus, pushing the bolus into stomach. Swallowing in babies. Swallowing hard and solid food by babies below 6 months is prevented by gag reflex or pharyngeal reflex. Gag reflex prevents choking. Applied physiology. Disorders of swallowing. Applied physiology disorders of swallowing. Dysphagia. Dysphagia means difficulty in swallowing. Causes of dysphagia. Causes of dysphagia. Mechanical obstruction of esophagus due to tumor structure, narrowing of tubular structure, and diverticular hernia, outpouching of a wall. Decreased movement of esophagus due to neurological disorders such as Parkinsonism. Muscular disorders such as sphincter to relax during swallowing. The accumulated food substances cause dilatation of esophagus. Features of esophageal atresia. Common features of the disease are dysphagia, chest pain, weight loss, and cough. Gastroesophageal reflux disease, GERD, is a disorder characterized by regurgitation of acidic gastric content to esophagus. The regurgitated gastric content flows into pharynx or mouth. Causes of GERD. Causes of GERD. GERD is due to weakness or incompetence, failure to constrict of cardiac sphincter. To constrict the cardiac sphincter. Features of GERD: heartburn or pyrosis, painful burning sensation in chest due to regurgitation of acidic gastric content into esophagus. Esophagitis, inflammation of esophagus, dysphagia, cough, and change of voice, esophageal ulcers or cancer in chronic disease. Tracheoesophageal fistula and esophageal atresia. Tracheoesophageal fistula or tracheoesophageal fistula or TEF or TE fistula is a congenital defect. A TEF is a congenital defect characterized by abnormal connection between trachea and esophagus. Air can pass through the fistula and enter gastrointestinal tract, resulting in distension of intestine. Also, liquids taken by the baby may enter lungs, causing pneumonia and breathing problems. Tracheoesophageal fistula is often associated with esophageal atresia. Esophageal atresia is another congenital defect in which the esophagus is shortened and closed off, forming a blind pouch at any level along its length. As it develops mostly along with tracheoesophageal fistula, one or more fistula may be formed between the defected esophagus and the trachea, resulting in feeding and swallowing difficulties. When the baby tries to swallow, there is a regurgitation because of the blind pouch of esophagus, leading to choking. Entry of mucus and saliva into trachea causes breathing difficulty and pneumonia. So this is all about the deglutition or swallowing. Deglutition